Okay, so like, you know how we always like put doctors on this pedestal?
Right.
Like they're these all-knowing beings
Mm.
who are somehow immune to the human experience of getting sick.
Yeah, it's a very common perception, isn't it?
Right.
As if their medical knowledge somehow shields them from the anxieties and uncertainties we all feel when it comes to our health.
Exactly. But what happens when the very people who are diagnosing and treating illnesses
Right.
become the patients themselves?
Yeah.
What's it like to be on the other side of the stethoscope when you're the one with the symptoms?
Well, that's exactly what we're going to explore today.
Okay.
We've got this fascinating Reddit thread
Okay.
where actual doctors are sharing their experiences of being patients.
Okay, so spill the tea.
Yeah.
What are these doctors saying?
Okay.
Is it all calm acceptance and perfectly recited symptoms? Or do they freak out and self-diagnose with WebMD just like the rest of us?
Well, it's definitely not all textbook calm.
Okay.
You see, the thread reveals this incredible range of experiences and approaches. Some doctors are amazingly good at compartmentalizing,
Go.
putting their medical knowledge aside when they're the patient,
Okay.
but others admit to struggling with the same fears and biases as anyone else.
Wait, really? So even doctors get freaked out when they're the ones in the exam room?
Absolutely. Remember that story about the breast cancer surgeon who was diagnosed with breast cancer herself?
Oh, wow, yes.
Yeah,
The one who looked at her own scans and just knew right then and there what her prognosis was.
exactly.
Yeah.
And it's a chilling example of how even the most extensive medical knowledge can't fully protect you from the emotional impact of a serious diagnosis.
Right.
In that moment, her expertise, which usually brings comfort and clarity to others,
Yeah.
became a source of incredible dread for her.
Wow. That's heavy.
Yeah,
Makes you wonder if maybe there's a hidden cost to having all that medical knowledge.
there very well could be.
Yeah.
And it brings up another interesting question.
Mm-hmm.
How often do doctors self-treat?
Right.
I mean,
Where
they have the knowledge,
exactly.
the access to medication.
Right.
Is it tempting to just skip the whole doctor's visit and handle things themselves?
I mean, that's what I would do,
Sure.
but is it ethical?
Yeah.
And where do they draw the line?
The doctors in the thread seem to agree that self-treating for very minor issues is pretty common.
Okay.
Like one oncologist mentioned only seeking medical attention for things they couldn't easily manage on their own.
Makes sense.
But for anything potentially serious,
Yeah.
most recognize the need for a second opinion,
Right.
a fresh perspective that can help them overcome potential biases.
That makes sense.
Yeah,
You wouldn't want your own anxieties or preconceived notions to cloud your judgment when it comes to something serious.
right.
But what about doctor-to-doctor communication?
Yeah.
Is it all super efficient with
Yeah.
doctors speaking in medical shorthand and
Yeah.
skipping the explanations?
It's interesting because there's no single answer there either.
Okay.
Some doctors in the thread loved the efficiency.
Okay.
They could present their history and get a treatment plan in seconds. No need for lengthy explanations or hand-holding,
Got it.
but others actually preferred being treated like any other patient.
Really?
One neurologist described those doctor-to-doctor interactions as less defensive.
Less defensive? What does that even mean?
Well, think about it.
Okay.
When you're talking to another doctor,
Yeah.
there's a certain shared understanding,
Mm-hmm.
a mutual respect for each other's knowledge and experience
Okay.
that can create an environment where both parties feel more comfortable being open and honest
Okay.
without worrying about being judged or second-guessed.
So it's less about proving yourself and more about genuinely trying to figure out what's going on.
Exactly.
Interesting.
And sometimes that's exactly what patients,
Yeah.
even doctors
Right.
need.
Yeah.
Not just a diagnosis and a treatment plan,
Uh-huh.
but a genuine human connection,
Right.
a sense that their concerns are being heard and validated,
I like that.
which leads us to this really fascinating paradox.
The worst patient?
Oh, you mean the ones doctors dread seeing? Precisely.
Oh, yeah.
And ironically,
Yeah.
it's often those with a little bit of medical knowledge who think they know everything.
Phyllis, my aunt's a nurse, and she said totes.
You got it. There's even a story in the thread about an ER doctor dealing with a patient who demanded a full-body MRI for a runny nose
Oh, wow.
because their aunt, a nurse, told them that's what they needed.
Oh, wow. So even a little bit of knowledge can be dangerous if it's not paired with humility and a willingness to trust the experts.
Right.
But speaking of trusting experts,
Yeah.
do doctors ever struggle to do that when it comes to their own health?
That's a great question, and it's something that comes up a lot in the thread.
Okay.
It seems like even doctors can fall into the trap of downplaying their symptoms or avoiding going to the doctor altogether.
Yeah, I remember that story about the doctor whose wife almost missed a pneumonia diagnosis
Yes,
because he kept telling her to stop overreacting.
exactly.
Yeah.
It's a classic example of how even doctors can be blinded by their own biases when it comes to the health of their loved ones.
Right.
Pneumonia, by the way, is an infection that inflames the air sacs in one or both lungs,
Oh, okay.
and it can be very serious if not treated properly.
Right.
In this case, the doctor's personal experience and perhaps his desire to reassure his wife ended up delaying her getting the care she needed.
That's a great point.
Yeah.
It's like their medical knowledge is battling with their personal feelings, and sometimes the feelings win out.
And it highlights just how important it is for doctors to have a support system,
Yeah.
people they can turn to for an objective perspective,
Okay.
even when it's uncomfortable.
Okay, so we've talked about the emotional impact of expertise,
Right.
the ethical considerations around self-treating,
Yeah.
and the unique communication dynamics between doctors when they're both the patient and the provider.
Right.
But what about when doctors are dealing with specialties outside their own expertise?
Well, that's where things get really interesting.
I'm all ears. Let's dive into that in part 2. So you're saying things get interesting when doctors have to deal with specialties outside their own area of expertise.
Well, what we see in this Reddit thread is that even doctors have knowledge gaps.
Right.
They rely on other specialists just like any other patient would.
Makes sense when you think about it.
Of course.
Mm,
Think about a cardiologist encountering a rare dermatological condition.
they'd be lost. Right.
Well, not lost exactly, but they would certainly need to consult a dermatologist.
Right, so even specialized knowledge has limits.
Exactly. No one can be an expert in everything.
Right.
And this thread really highlights that even doctors have to acknowledge their limitations and seek help when they're out of their depth.
It's humbling, isn't it?
Yeah.
To think that even these brilliant medical minds have to say, I don't know sometimes.
It is. And I think it's a really important lesson for all of us.
Yeah.
It's okay to not have all the answers.
Right.
It's okay to ask for help.
Yeah.
In fact, it's often the smartest thing to do.
Especially when it comes to our health.
Absolutely.
Yeah.
Now, going back to the idea of doctors being patients,
Okay.
the thread also dives into some interesting observations about how doctors approach their own health.
Like what?
Well, for example, there's this sense that doctors are more pragmatic about their health,
Okay.
maybe even a little bit more fatalistic.
Fatalistic.
Like they've seen so much illness and death that they have a different perspective on their own mortality.
So they're not as worried about every little ache and pain.
Not necessarily,
Okay.
but there's a certain acceptance,
Okay.
a recognition that even with all their knowledge and expertise, they can't control everything.
Right. It's like they've made peace with the uncertainty of it all.
In a way, yes.
Yeah.
And that can be both a blessing and a curse.
How so?
Well, on the one hand, it can help them avoid unnecessary anxiety and focus on what they can control.
But on the other hand,
There's a risk that they might downplay serious symptoms or delay seeking care because they've become desensitized to the signs of illness.
yeah, it's like they're too close to the forest to see the trees.
Exactly. And that's why it's so important for doctors to have a strong support system,
Right.
people who can provide an outside perspective and encourage them to seek help when they need it.
People who can remind them that it's okay to be vulnerable,
Yeah?
to not have all the answers.
Precisely. Because at the end of the day, doctors are human beings, just like everyone else.
Right.
They have fears and anxieties, hopes and dreams.
Of course.
And sometimes they need a little help navigating the complexities of their own health, just like the rest of us.
Right.
Exactly. Now, shifting gears a bit,
Okay.
remember we talked earlier about how some doctors prefer to be treated like any other patient?
Yeah, the whole less defensive
Mm.
thing.
Well, this desire for a more humanized approach to healthcare isn't limited to their own experiences as patients.
Right.
It actually extends to how they think about the doctor-patient relationship in general.
So they want to see a shift away from the traditional hierarchical model.
It seems that way.
Yeah.
Many doctors in the thread expressed a desire for more open communication, more collaboration between doctor and patient.
A more equal partnership.
Yes, exactly.
Okay.
Where the patient feels empowered to ask questions,
Right.
share their concerns,
Hmm.
and be actively involved in their own care.
It's like they're recognizing that the patient is an expert in their own body and their own experiences.
Absolutely.
Yeah.
And that those experiences are just as valuable as the doctor's medical knowledge when it comes to making treatment decisions.
It's a really interesting shift in perspective, isn't it?
It is.
Yeah.
And it speaks to a growing awareness within the medical community that the traditional model of healthcare,
Okay.
where the doctor is the all-knowing authority
Right.
and the
Okay.
patient is simply a passive recipient of care,
Right.
is no longer serving everyone's best interests.
So how do we move towards this more collaborative model?
Well, it starts with communication.
Okay.
Both doctors and patients need to be willing to listen to each other,
Uh-huh.
to share their perspectives openly and honestly,
Right.
and to work together to find solutions that meet everyone's needs.
It sounds like a tall order.
It is. But I think it's a challenge worth taking on
Yeah.
because
Yeah.
ultimately it's about creating a healthcare system that is more humane,
Yeah.
more effective,
Uh-huh.
and more responsive to the needs of everyone involved.
I like the sound of that.
Yeah.
But I'm curious.
Sure.
Are there any other surprising insights that emerged from this Reddit thread?
You bet there are. We'll delve into those in part 3.
All right, we're back and ready to wrap up our deep dive into the world of doctors as patients.
You bet.
You mentioned there were some more surprising insights from that Reddit thread.
Oh yeah, there are definitely some nuggets in there that really make you think.
Well, don't leave us hanging. What else did you find?
One thing that stood out was how doctors view the healthcare system itself.
Okay.
Remember, these are the people working within the system every day,
Right.
seeing its strengths and weaknesses firsthand.
So they have a unique perspective on what works and what doesn't.
Exactly. And many of the doctors in the thread expressed a deep frustration with the bureaucratic hurdles and administrative burdens that often get in the way of providing good patient care.
It's like they're trapped in a system that's not always designed to serve the best interests of patients or providers.
That's a great way to put it.
Yeah.
They see the inefficiencies, the waste,
Yeah.
the focus on profits over people,
Uh-huh.
and it can be really disheartening.
Especially when they went into medicine with the intention of helping others.
All right. It's a real clash between their idealistic aspirations and the realities of the system they're working within.
So what can be done about it?
Well, that's the million-dollar question.
Yeah.
Some doctors in the thread advocated for systemic change,
Okay.
pushing for reforms that would prioritize patient care over profits.
Big picture stuff.
Exactly. Things like universal health care coverage,
Sure.
reduced administrative burdens,
Yeah.
and a greater focus on preventative care.
So it's like they're recognizing that the current system is unsustainable both for patients and for providers.
Absolutely. And they're calling for a fundamental shift in how we think about healthcare,
Okay.
moving away from a reactive, disease-focused model
Yeah.
to one that emphasizes wellness and prevention.
More holistic approach.
Precisely. Now, this next insight might surprise you.
Okay.
Several doctors in the thread talked about how their medical knowledge actually made them more cautious about seeking medical care for themselves.
Really? That seems counterintuitive.
Right.
You'd think they'd be more likely to catch things early and get treatment right away.
You'd think so, wouldn't you?
Right.
But it seems like their knowledge of the potential risks and side effects of medical interventions actually makes them more hesitant to jump into treatment unless it's absolutely necessary.
Because they've seen the downsides firsthand.
Exactly. They understand that every medical intervention comes with potential risks, and they're more likely to weigh those risks carefully before agreeing to any treatment.
It's like they're practicing a more informed and cautious approach to their own healthcare.
Precisely.
Yeah.
And it's a reminder that more medicine isn't always better medicine.
Right.
Sometimes the best course of action is to wait and see,
Yeah.
to let the body heal itself,
Yeah.
or to explore alternative therapies.
It's a more nuanced approach, one that takes into account the whole person, not just their symptoms.
Absolutely. Now, there was one final insight from the thread that I found particularly thought-provoking.
Okay.
It was this idea that even though doctors have all this medical knowledge, they still experience the same fundamental human emotions when it comes to their health.
Like fear, uncertainty, hope.
Exactly. They might understand the science behind their diagnosis, but that doesn't mean they're immune to the emotional roller coaster that comes with being sick.
It's a reminder that even the most brilliant minds are still subject to the same human vulnerabilities.
Precisely. And I think that's a really important takeaway from this whole deep dive. It's about
Excellent.
recognizing the shared humanity that connects us all, doctors and patients alike.
We're all in this together.
Exactly. We all face health challenges at some point in our lives,
Right.
and we all need compassion, understanding, and support as we navigate those challenges.
So what's the biggest takeaway you want listeners to walk away with from this deep dive?
I think the biggest takeaway is this. Even doctors are human.
Right.
They get scared,
Uh-huh.
they make mistakes,
Yeah.
they have doubts, but they also have an incredible capacity for compassion.
Yeah.
resilience, and a deep desire to help others.
And that's something worth remembering, whether you're the one seeking care or the one providing it.
Absolutely. The next time you're interacting with a doctor, remember that they're not just a medical expert. They're
Right.
a person just like you,
Right.
navigating the complexities of life and health just like you.
And that shared humanity can be a powerful bridge, creating a space for more open communication, greater understanding, and ultimately a more compassionate and effective healthcare experience for everyone.
Beautifully said. Thanks for joining us on this deep dive.
Until next time, stay curious and keep learning.